So today we'll be talking about a lot of issues related to IVF, egg donation, garment freezing, and what have you. So stay tuned and enjoy the show. So yes, we're talking about egg donation. A lot of controversies come up with egg donation. So what is egg donation in relation to IVF?
Yeah, it's actually a very big issue, egg donation in IVF. You know, a lot of women come to access IVF services at very advanced age, or at the age where their eggs are not great, the qualities of the eggs are poor, or they're almost running out of eggs. And the only option that seems to be a little bit reasonable for them is the option of egg donation. Okay. This is so because a lot of women take the step, a lot of couples take steps towards IVF when they're already advanced in age.
Yeah,
usually
true.
At that age, little or nothing, could be done with their eggs.
Yeah.
And so they're given the options of having to use egg donation. Egg donation just means using the egg of another person, usually a younger age person, in achieving conception. Usually the eggs will be treated with the female partner's sperm, or whichever sperm she adopts or opts for, with an egg that is not originally hers to achieve conception. But then let me put the statistics to this. In Africa or sub-Saharan Africa, most IVF treatment cycles actually are done with egg donation. If you're having, let's say, it's just like 70 to 80% of IVF done in this part of the world are done using egg donation. So the burden of egg donation is actually very high, and this is what the society is not yet aware of. Mm-hmm. And this is also a fallout of women or couples not assessing the services of assisted reproduction technology early enough when they still have viable eggs, until they are out of eggs or they advance in age, until they've come to their right senses to access help with assisted reproduction technology. And at those stages, they have little or no eggs, and then the only option staring them in the face is the option of egg donation.
So who needs egg donation? Because I'm made to understand that sometimes quality of eggs can be related to age for those people that are advanced in age. Then sometimes for those people that have polycystic ovarian syndrome. So, and then there are other factors too that can actually require one going for egg donation. So who are those people that need egg donation?
Okay, I think he rightly mentioned. But before then, I would like to start by saying when we talk about egg donation, in IVF, we shouldn't just center on the woman alone. There are also men who might require sperm donation too.
That's true.
Yeah, so like he rightly mentioned, most people that do come to access IVF are usually people who are advanced in age. Yeah, so people who are advanced in age, statistics has shown that when a woman is about 42 years or thereabout upward, her chances of conceiving with her own eggs is about 1 or 2%, so to say. So those category of people who are running out of eggs at that particular period of time, or who are approaching menopause, might not have a good viable eggs that could be used in achieving pregnancy, even in the spontaneous conception. So those category of people are basically the people who need egg donation. And in the cases of men too, where you discover men that are azoospermic, or men that have very poor sperms with poor morphology, even poor motility in the sperm. So some of them might conceive spontaneously, but they keep on having recurrent miscarriages. Yeah, so because the DNA integrity of the sperms are depleted. So in that case, people within those categories too might also require sperm donations. But I think basically the people who need egg donations basically are those who are out of eggs, or those who have bad eggs.
Okay. So if we could add to that, those still needing egg donation, you could have young women, needing egg donation. And what makes them need egg donation? There are a lot of young women who have premature ovarian insufficiency. That's to say, they have ovarian failure. Their ovaries have stopped functioning before the age of 40. We've seen them at 30. We see them at advanced 20s, we see them mid 30s or before 40. For some weird reasons, maybe autoimmune conditions or genetic programming, their ovaries stop functioning. They don't produce eggs anymore. They need egg donation irrespective of the age, usually now young age. There are people who may have had some form of cancer in their childhood and have been subjected to some cancer treatment. Maybe radiotherapy or chemotherapy without consideration of their fertility potential or fertility future. You know, these therapies actually can affect your reproductive cells, and then a woman's ovarian reserve can be depleted. The same happens to the man. The ovarian potentials may be depleted, and they could find themselves needing egg donation. And that's why it's advisable, if a woman will go for any cancer therapy, you know, there should be some form of ovarian shielding or testicular shielding, so they are not impacted upon by radiotherapy. But for chemotherapy, for instance, you know, we're looking at the future where CRISPR or genetic editing or genetic knowledge of the human genome can be applied in designing chemotherapeutic agents, so that cancer medications, for instance, can only hit the cancer cells and spare the normal cells. Because at the moment, a cancer medication hits all the human cells. That's why you see they don't have heads, they are purging, they have problem with the tongue. Every mucosa in the human body is affected, including the gonads. You know, so we're looking at a future where cancer cells can be tailored just to hit the cancer. You know, I mean, cancer medications will be tailored to hit only the cancer, and the human body is spared. That way we can avoid that. So you have these categories of people needing egg donation. Polycystic ovary people too, advanced stage, I mean the phenotype Ds of polycystic ovary may require egg donation. Of course, we've seen a lot of them because they are poor eggs or no eggs, needing egg donation. So it's a very popular option in fertility treatment. It's even more popular than those using their own eggs.
Very true.
For IVF, as we see in the real practice. You know, but then the world hear about egg donation and they go haywire, as if something abnormal is happening. But then the reality is that if you have a delay in conception till you advance in age, or you have any of the conditions that we've mentioned that leaves you with depleted or no eggs, you may be needing egg donation in assisting in achieving a pregnancy. Now, the challenge is you have a lot of misconception even amongst women. They think that because they menstruate, because they're menstruating, means they have eggs. You know, when women say all of this, it takes me aback. It takes me, I mean, I'm surprised hearing that. The fact that a woman menstruates doesn't mean she's ovulating. She may be ovulating, but even ovulating very poor eggs. So menstruation is not synonymous to ovulation. Usually when you tell them they need egg donation, they say, no doctor, I'm still menstruating.
Or even synonymous to having good quality eggs.
So you could be menstruating and not having eggs, but you could be menstruating for some reasons, maybe withdrawal bleed from excessive hormone exposure, you know, and you just could be menstruating and no eggs. So menstruation is not synonymous to ovulation, as you hear a lot of women in their 50s or advanced 40s always mention. And
then sometimes you know, as an IVF nurse, you get to hear from this client saying, so if I'm going for egg donation, how would they pick someone that has my physique, someone that has my all this? I want this. I want a tall person. I want a fair person. Okay, I think all those fears should be allayed, because usually in picking these donors that we use for those women that require the donors, there is a careful selection. Tests are actually done to make sure that these girls are well screened to prevent any transfer of any form of disease or infection, and then their physique and whatever is also put in place. So those fears should actually be allayed because all that is actually put in place.
Oh, yeah.
So if that's one of your fear as a woman, it's something that should be your least worry because you are actually safe with regards to that. So now, as we have the donors and then the eggs are retrieved, sometimes you get to have excess, and then what is this excess? What do you do with the excess that is retrieved when you have used the one that is required for the particular couple? Maybe the sperm and the eggs needed for them has been fertilized and all that. So the excess left, what do you do with it?
Yeah, Paul, you're the embryologist. should answer
that. Oh yeah, that's a very interesting question. Sometimes consent has been given to them, but before then we need to educate them to know that in cases where we get excess eggs, they can be frozen or treated, or we treat all the eggs in most cases, and then we select the best quality embryos. So for instance, if a woman should have 10 good eggs or 10 eggs retrieved from the donor, and then those 10 eggs are treated, maybe 6 or 7 of them are good, and we discover that they get to the highest stage, that's the blastocyst. So we can transfer like 2 or 3 for her, depending on how many she wants to be transferred, and then her chances also of achieving pregnancy or conception with that. So the remaining embryos, we usually educate them, give them a consent to sign so they can be frozen. So we can freeze those embryos, and then after a particular period of time, or if the current cycle is unsuccessful, then she can come back for her own her remaining embryos, and then it saves her lots of time of undergoing the long procedures. So she just needs a little preparation before another embryo transfer again. Or if she achieves pregnancy during the first one, she can also come back after like a year, 2 or thereabout, anytime she wants to come back, and then she comes back, gets her remaining embryos too. So it all depends on what she wants to do.
So
but,
in addition to that, those embryos, the excess embryos, can be donated to other couples.
Yeah, that's true.
They can be donated to other couples. Recently, the world recorded the oldest frozen embryos to have developed into pregnancy. I think it's from the United Kingdom or something.
Yes, UK, yeah.
Frozen for how long? About 30 years?
30, yeah.
Yes. So these embryos were frozen for 30 years. And another couple used them in achieving pregnancy. So that's a record baby right now in the world.
Wow.
The oldest embryo, the oldest, the oldest frozen embryos to have resulted into baby. That's the beauty for me of reproductive medicine. Yeah. We had this story in our center. A woman got pregnant after one attempt, but she had excess embryos and were frozen. She delivered twins. Then after 2 years, she wanted to still achieve pregnancy. So out of the frozen embryos, 2 were thawed and transferred. She still got twins from that same from the embryo transfer. So then she delivered twins again. So in real life, she has 4 kids now
of the same age.
Born
at different times.
They were fertilized at the same time. Some decided to come earlier than others. Some came like 2 to 3 years later.
You can just imagine like the woman in the UK who donated her embryos 30 years later. Imagine a grown-up man like me and then newborn babies.
All age mates. That's the beauty. But the advantage of that is this. The embryos frozen today, good embryos frozen today for a woman are going to be better than fresh embryos that are generated for her in the next 3 to 4 years. The reason is this: as a woman gets older, her body deteriorates, the quality of egg deteriorates, the quality of her partner's sperm may also deteriorate, her health status may deteriorate. So chances are that she is going to produce poorer qualities of eggs with more genetic abnormalities and aneuploidy. So she's better off having embryos frozen previously
Yes.
than a fresh treatment.
Yeah.
And of
Very
course,
true.
study or research has it that frozen embryos even produce better pregnancy than
outcome than fresh embryos.
than fresh
embryos.
embryos. So there's a lot of advantage to it. It saves time, it saves cost, it preserves the genetic integrity of the embryos or of the gametes.
Oh yeah.
So it's actually very interesting. And so for us, our oldest embryo that have developed into a baby from freezing is about 2 to 3 years.
Wow,
You
that's
understand? So,
amazing.
but we're happy to hear that there's a 30-year-old embryo.
Oh yeah.
That just became just delivered as a baby. So it's a beauty.
Okay.
It's an absolute beauty.
So in our African community today, a lot of men believe the problem is with the woman. So what do you have to say about the quality that a sperm has to play in IVF treatment? Like the quality of the sperm, what role does it play in the success of pregnancy? Yeah, because a lot of them just feel all is well, like everything good can go, nothing can go wrong with their sperm. They just believe it's all about the woman. So what can you really say about a very bad sperm? And then they still feel, no, it's good, yeah, and all that.
Yeah, it's very unfortunate that most men will feel the fact that they ejaculate sperms and they can see the whitish or grayish mucus-like sperms outside. They feel okay. Their fertility status is intact, or they will be able to achieve or achieve conception with their spouses, so to say. But it might interest you to know that what people just look out from the outside is not what determines conception. So the role of the sperms in achieving conception cannot just be overemphasized, because recently researchers have shown that even people who achieve conception and later have miscarriage, like recurrent miscarriages, is affiliated to the bad sperms. So the sperms, we check out the morphology of the sperms, and then even the way they move, and then their count. So the role of the sperm is very, very important in IVF treatment. No matter how low a sperm count is, if it has a good morphology to some extent, it's better off than somebody who has a high count with very poor morphology. Because with that, even if a woman gets pregnant, I think the pregnancy would not go that further to term. It might not be a healthy pregnancy, so to say.
Okay. So to wrap up this, recently we had this issue with a client where she was giving details of her husband about egg donation, and where she said, yes, some genetic matters can be transferred into her if she's carrying a donor egg and all. Sometimes some men find it very difficult. They will just tell you that, in fact, if my wife is using a donor egg, it's as good as going to impregnate someone else. So I want us to also throw light on this for them to have a prior knowledge, a better understanding. Are there any transmission of any genetic material from the person carrying the pregnancy and the donor egg they are using?
Yeah, that interests me a lot, because when I counsel women about the preferred option, which may be egg donation for them, the first question they ask often is that who would the baby look like? Whose genes should the baby be carrying? So it's very important to them what genes makes up the baby. Yes, their partner brings his sperm and they are carrying donor egg. Literally, it does appear as if it just you're the carrier, the mother, and the bearer of the pregnancy is the carrier. But that's not necessarily so. When a woman carries the pregnancy using a donor egg, there is a transfer of genetic materials from her onto the embryos. Those are the evidences that research has shown. And that's why in so many cases you see the baby looking like the mother, because there is a transfer of genetic substances from the mother to the baby, because by some form of osmosis through the blood onto the baby. So it's not absolutely that it's a strange person's egg. Just not strange person's egg. So those are the evidences. And you know what? Actually, it was a patient first that drew my attention to this, because she went researching. what happens to me when I carry another person's egg. And she came with a lot of papers. I was like, interesting. You know, sometimes patients can be very interesting. They can educate you and throw you in line to what you need to also know as a professional. So I learned from that and went research into, and I came up with all of this information, just like she had already shown me. So for those who are faced with the challenge of taking egg donation, it's not all about somebody's eggs. You know, there is a transfer of genetic material from the mother incubating or carrying the baby or the fetus to the fetus that tends to even replace the genetic material coming from the donor of the egg. So there is no worries, no fears. And egg donation, by the way, is practiced all across the world. It's practiced in Europe, practiced in Asia, practiced in Africa in large numbers. You know, because most people go to the fertility specialist when they're already advanced in age, and then the only options they have is options of egg donation. But the only way to prevent it is that if you think you're not going to get married easily, early, and your eggs are wasting, like as science have it, any month you don't get pregnant, you lose 1,000 eggs. That's the current evidence. And then the eggs you're losing today or this month are better than the eggs you're going to lose next month. You could take a bold step to actually visit a fertility consultant and have your eggs frozen, so you can use your frozen eggs 10, 14, 20 years later when you're about 40 and achieve pregnancy without going through egg donation, if egg donation should be a problem to you. So there are a lot of options. You know, in England right now, there's a study going on. When girls are given birth to, you run a genetic analysis in them to see their ovarian potential. To see how far their reproductive life can be vis-a-vis production of eggs, quality of eggs. And then they will be counseled as they're growing that you probably will not be able to have eggs when you're 35, 40 or so. So make good reproductive plans. So with this knowledge now, you get into 30, for instance, if your genetic analysis shows that you will not be fertile with respect to production of eggs at 30, when you're 20, 25, you want to freeze your eggs. Should marriage or desire to have babies don't come across your way before 35, you have frozen eggs. So, because nature can actually be wasteful. How would you explain this about nature? A woman is born with close to 700,000 eggs at birth. At puberty, she has about 400,000 eggs, but she didn't get married in time. And when she's married, advanced in age, she has no eggs. She's wasted all the eggs. Nature have wasted all the eggs.
Why should it even be a problem in the first place? Egg donation. What I keep on saying is egg donation shouldn't even be a problem in the first place. Because if you would be willing enough to take someone's blood, people donate blood and then people donate kidney organs and every other thing. Then why would egg donation come with some kind of sentiment? Well, for me personally, I feel if you would be able to adopt a child from anywhere and then treat him like your own child, then it's
much more
to some extent, should I say, it's inhuman for you to consider egg donation as different to that.
So I think a message to young ladies, it's a good thing that recently, I think sometime last year, we had a young girl that came to the facility and she said she wanted to freeze her eggs, and I was surprised at what she said. I was like, why? She just said she just wants to do it. I think recently she was diagnosed with PCO, so she doesn't want to take chances. She just maybe now she can still get quality ones, so she just wants to keep them on reserve, sort of. So I think even aside people that have PCO, as a young lady, sometimes you might not know what really the future holds. It won't be a bad idea too to actually, it's not like they're removing all the eggs in you, but it's be good that you have a reserve somewhere. So freezing is a welcome idea too for young ladies, just in case the future comes otherwise and you don't get married when you should get married, that you get good quality eggs. So with this today, we've come to the end of today's episode of Ask Dr. Ken. Thanks for staying tuned with us. Keep up for the next episode. Thanks.